An Austin couple under self-quarantine.
We were prepared, not panic prepared, but like we were prepared. So we're fine on food and everything, but it's been stressful because we've just been waiting. There's nothing you can really do except for Tylenol, So we've been resting and doing Tylenol. I started getting a fever last night. Mine's 99.5.
We spoke to Leslie Jones, who says over the weekend her wife started to become sick.
We thought she was super dehydrated, and we were just trying to, have her drink lots of water.
Jones says they called their clinic and told them her wife's symptoms, which included fever, fatigue, a headache, and some back pain.
She has rheumatoid arthritis too, so she's usually in some pain, but it was extreme pain.
She says they were told to go to the emergency room. There, she says her wife was tested for a lot of things, but all came back negative.
Flu, strep throat, do a full blood panel, urine sample, and chest x-ray.
Something she says they didn't test for was COVID-19.
After all that came back clear, I asked the doctor, is it safe to assume that she has COVID-19? And she said, yes, you can assume that now, and you need to go home and self-quarantine for 2 weeks.
Still wanting answers, Jones says they looked up other options but kept getting referred back to where they came.
We just came from the emergency room and they wouldn't test her.
She says the whole process just to figure out if her wife even has COVID-19 is just too confusing.
That's my wife, and when someone you love is suffering and sick, I don't really appreciate being told you can assume something. I want to know, and I can't have that right now.
Beginning next week, the Austin-based company Everly Well stated on their website they will be offering take-home testing for COVID-19. Their initial supply consists of 30,000 tests. The price is $135. We also reached out to LabCorp, a company which says by the end of the week can perform more than 20,000 tests per day. They tell us their tests can be ordered through physicians or healthcare providers who collect the samples and send it to their lab. They have not told us how much these tests cost. Jones says they may be looking into these options.
I think we're going to make some calls first, of course, before we just go out into general public again. I want to take the right steps to be precautious and, safe and not expose anyone else.
As more testing becomes available, Jones hopes there is a cheap or potentially free option for those who need it.
Luckily, we have insurance, but there are some people who don't, and they're going to suffer financially and not even be able to get the help that they need.